next guest has been hiding her big smile because of her small teeth. And when she made the big decision to do something about it, she turned to someone who makes the world a better place one smile at a time. Please welcome back Dr. Terry Alani and her patient, Sandra Hadur. Good morning. And she has such a beautiful smile, but she was hiding that smile. And Dr. Alani, you see this a lot where people literally have trained themselves not to smile because they're ashamed of their teeth.
All the time. And it's incredible how just an experience of transitioning them makes such a life change experience.
Yeah, because I'm looking at you,
Yeah.
you can't stop smiling right now. I mean,
I love those.
yeah, but you literally didn't smile. So what was it about your teeth that you didn't like before?
They were very small, and I just didn't like the shape and the color of my teeth, and I felt like I had children's teeth instead of a grown-up teeth.
Yeah. All right, so Dr. Alani, that is one reason why veneers can work, because they can help to reshape.
Exactly, and she has such a big personality. So she had these tiny teeth, and she'd come into the office, and I'm like, you've got to have bigger teeth for your face. So what veneers can do, it was really interesting because with Sandra, we did minimal preparation. So we...
Now, see, when you say veneers, I think, and this is one of those things in medicine that people need to do, is to like catch up, because in years past, it could be a long drawn out process,
exactly.
right?
And we did 8 teeth, and we didn't even need to number up. We take about 0.5 millimeter of enamel off. That is it. Most people come in and they're so afraid to have veneers done. They're like, I don't want to have my teeth cut down like a crown. We don't do that with veneers. They've become like contact lens thin now. And the materials are very strong and very aesthetic. They've changed over the last 10 years. Yeah. So really, it's a 2-appointment procedure. She comes in, we prepared them without anesthesia. Sometimes it can be minimal anesthesia, whatever is comfortable for the patient.
Right.
We take the impression. We have a boutique lab that we work with. We help the patient with the color and the shape and what have you. We decide. And then 2 weeks later, we try them in. And they might need some tweaking, but that's it. It's usually 2 appointments.
Yeah, you know, and I'm staring at them, and I'm trying to see where they would be veneers, and I can't tell.
They look like they grew in the gums.
They're the teeth that she's supposed to have right there.
She is fantastic. She's awesome. She really puts you at ease. She explains all the process from the beginning. You know what you're getting into. You know what to expect.
Aww.
And she's just into the details, so it's like art.
Yeah.
That's why they look so good. It's all to her.
I'm
she is fantastic. I really love
I think I had
Dr.
one like way back here, and I was like, no one's going to see it. You're like, but I'm seeing it.
A lot of people come in and they'll go, oh, I don't want veneers because I don't want people to know that I have them. They're bulky. But her teeth, I mean, they're not bulky. You have to make them very thin and make sure that they fit right at the gum line, so when they smile, they look natural.
But this
and
is
that's
the
really
technology,
important.
Right?
Exactly. It also has to do with the experience of the dentist as well, because if you're trained, then you know exactly what the outcome will be.
All right, when you first looked in the mirror after they were done, what did you think? And did you have to get used to smiling again?
Yes, I used to smile a lot, but just wouldn't show my teeth as much.
Yeah.
Now she can't stop smiling.
No, I can stop smiling. But my first reaction, I just could not believe it. It was just, wow, this is what I'm supposed to look like. And I gave her a big hug.
All right, so wipe off the lipstick on your teeth. Now you have some lipstick on your teeth. Okay, then I want you to look straight into the camera, and we're going to look at your before and after a little more. So we saw that a little bit earlier. But you can see just the size fits your mouth better. All right. Well, let's talk about a little bit more about veneers. Okay, so as you mentioned, you can use them to kind of reshape teeth if somebody's color of their teeth are off.
Exactly. And filling out the buccal corridor. A lot of people, when they smile, you only see their front 6 teeth, and they get a shadowing in the back. But we call that the buccal corridor. So you want to fill out. So usually you want to do 8 if you really want to fill in that smile.
Yeah. All right. And does the color that you picked stay that color forever, or do you need to?
Okay. Veneers do not stain.
We love
which is amazing. You can drink coffee. You can drink red wine. They do not stain. What happens is if you just have like one veneer, and like on your front tooth, you will notice that veneer will stay the same color, but your teeth as you get older will darken. Right. So you can always whiten that up to get, but they do not stain. The only thing that is detrimental is smoking.
Okay, which can be detrimental for a lot of other things.
Exactly, and a lot of people ask, do you get decay underneath your veneers? Very unlikely. The marginal integrity, they're sealed almost perfectly. So we always recommend coming in for your checkups. Let us make sure everything is okay, and you will not. The other thing we recommend is a night guard. Okay. Really important after you've had veneers is to wear a night guard, because the only thing that probably could cause breakage is some habit that happens when you sleep, some interference. We make sure that everything is clear after we do that, and your bite is proper. But a night guard is essential.
And they can pretty much last you the rest of your life?
7 to 20, nothing lasts forever, honey. 7 to 20 years, probably.
Okay.
I mean, I have patients that have had them for 25 years, but the materials have changed over time. But we say 7 to 20 years. It really depends on the patient and making sure you come in and keep up with your routine cleanings and checkups.
Yeah, yeah. All right. They look beautiful.
Thank you. Thank you. Thank you.
Yeah, they're great.